Safety is the most important principle when assisting a patient to get out of bed. Next, we'll demonstrate how the caregiver can assist a patient in this process. We will follow a gradual approach, starting by helping the patient to lie on their side. Before assisting the patient to get out of bed, we must first position their wheelchair safely and properly, and engage their brakes. Place the wheelchair at a 45-degree angle to the bed. First, lower the bed rails. Next, place one hand on their patient's buttock and the other hand on the shoulder to help them roll over. Move the patient's leg to the edge of the bed and place the other hand behind their neck, reaching to a shoulder blades. Support the patient's buttocks with their other hand to help them sit up from the side lying position. Now, we should stand directly in front of the patient. Use both hands to support the patient's shoulder to prevent any risk of falling. Also, inquire whether the patient feels dizzy or experience numbness in their hands and feet.
Do you feel dizzy or experience any numbness?
Next, we'll assist the patient in transferring to wheelchair. First, move the patient's buttocks towards the edge of the bed. Place your feet around the outside of the patient's knees. Then, slide the hands under the patient's armpit and grasp their pants. Let the patient's body lean naturally forwards against your shoulder. Next, use your hand to lift the patient lightly while using your body as a pivot to help them sit in the wheelchair. Stand behind the wheelchair and ensure the patient's posture is correct. Place your hands through the armpits, gripping both sides of the pants to help the patient move their pelvis backward. Position them correctly in the wheelchair. If the patient has a gastrostomy tube, be especially careful not to touch it. Pay attention to securing the wheelchair's wheels when transferring the patient, whether to wheelchair, commode chair, or shower chair. Next, lowering the wheelchair's footrest and place the patient's feet on it. This completes the transfer process.